Andrew, can you give a description of what we just did, and can you describe what you felt, and can you describe what you spontaneously reported afterwards?
Yes, we just did a 2-minute adjustment of the vertebrae in my neck at C1. We moved, I had motion to the left, I believe, and that needed to be corrected and straightened to center.
And after we did that, after we did restore more normative positional and mobility of C1, we then did something somewhere else.
Remind me.
I worked on the upper joint, the joint above that, which is where the occiput connects to C1.
Right, and I noticed immediately after the 2 different adjustments.
But hold on, let me back it up.
Okay.
At the joint, at the OA joint, I tested passive rotation, just really light rotation, very mild rotation left and right. And I tested side bending, and side bending was normative on both sides.
Right.
But when I sprung it to the right, I said there is movement there when I isolate that joint, but I use the term funky, great medical term, funky.
Yes.
So I said that's kind of funky movement. So then I tested it in an oblique manner, and I've stumbled on this of recent, and I've seen at least 3 clients in which the OA joint did not have normative motion restored by correcting any rotational limitation in the transverse plane or any side bent restriction or any side glide, but instead I had to mobilize it obliquely in a downward direction, 45 degrees. So it's an interesting new area for me to explore. And in your case, we did mobilize your right OA joint obliquely, and I'll let you take over.
Right. Well, immediately after the adjustment, I felt like more clear-headed, like I had more blood flow, circulation to my head. And standing up and walking around, I'm able to do so in a more relaxed manner. Previously, I really had to struggle to get myself up and into a position. And now I feel as though I can let my shoulders lie back in a really relaxed.
And can you show us that again, how posture took effort on your part?
I would really have to, engage my abdominals and kind of force myself back, and I'd feel really sort of stiff in the neck and upper shoulders, and now I'm just more in profile, a lot more relaxed compared to.
And you made a comment about your foot that really surprised me.
I noticed my, in combination with the neck and the previous adjustment done to my lower back area, that it feels as though my feet pronate less inward. I don't know if that's as accurate as to say it takes me less effort to make sure that I'm keeping them straight.
I'm quite astonished. I'm sincerely astonished. Let me bring the camera out here, and if you would step over there and face me, please.
Yes.
This is a remarkable thing because I'm seeing some arch there, and I have no explanation to it. I'm not even going to try and speculate, That was a remarkable comment that you made, so that causes me to want to try one more thing. And I need to just say this for the sake of the viewer, that you have a very complex medical history that I'm not going to detail in the purpose for the purpose of this film.
Okay.
And if you go sideways, you could make all kinds of comments like, well, your left hip is a little more externally rotated, and if you go ahead and stand sideways, and you would say that your posture is different from the norm or the ideal. But again, some of this has to do with the complexity of your medical history and your ongoing diagnostic workup. But I'm going to skip all of that, and let's have you come sit on the table, and I'm going to do a little bit more testing.
Sounds fantastic.
What did I say to you about your strength yesterday?
That I had good muscle tone and definition, but that it was astonishing that I was rather weak and could not resist certain forces.
Where were you weak?
I was weak in the muscles that control the pelvis stability, and also in the biceps to some degree.
Yeah, the biceps actually showed some strength, but I was able to ultimately break it.
Right.
Your abdominals were remarkably, pretty strong. but your hip flexors were very weak. Your hip abductors,
Right.
hip extensors were definitely weak. Your shoulder flexors, put your right arm in front of you. Okay, and don't let me push it down. Hold it there. Your thoughts?
It's not like yesterday.
I
So
agree.
I can keep it there.
I agree.
Yeah.
I have no explanation for
Yeah.
this. Let's try the other
Try
side.
the other side, yeah.
Yeah.
We've got tomorrow.
What did I tell you this morning and tell your parents what I thought about this generalized weakness?
I don't particularly recall. Well, it was surprising, for one. It was very surprising and confusing.
It was confusing, and what
Yes.
I felt like was that you were underdiagnosed, and that it was more of a metabolic or you know, I hate to use the word some disease process, but I'll go
Right.
ahead and do that. And I just felt like it was not it didn't come under the need for more strengthening. Yes, you needed to do more strengthening, but I felt like that did not explain
Mm-hmm.
why someone as active as you with this body type had that weakness throughout.
Right.
Okay, let's have you lie on your back and let me test your hip flexor.
Yeah.
So when you said that you stood and you felt more pronation and that you felt like your posture was altered, that cued me to come and test your strength.
Yes.
Put this leg down, please, and then lift this up, and then don't let me resist you. So we most certainly still have hip flexor weakness.
Mm-hmm.
Okay, so we have altered strength in your upper body.
Right.
We have more, seems like you have more strength in the foot because you have that, you feel like your arch is greater now.
Yes.
Let's test your abductor. Lie on your side towards me and lift that straight up, please, and hold it there. Don't let me push it. That is distinctly stronger. So we could continue to test you. How do you feel with that? How do you interpret that?
Yeah, it's my only, in testing the right leg and pushing straight down while it's up, my only, question would be, how does it relate to my pelvis and the deep sockets and
Yeah,
that
we can
possibly
talk about
explain
that.
for-
Yeah,
for anything.
you certainly do have some changes. You certainly have your hip sockets.
Yes.
Okay. Do limit your motion in 3 directions, but as part of this conversation, let's just ignore that. Please.
Right.
So your hip flexors did not change, but your left abductor did gain strength. Do you perceive that?
Yeah, I think so.
And lay on your left side. And what do you mean you think so? Elaborate.
Well, walking in general just feels easier.
Okay. So hold that up. Don't let me push it down. This gets a 5 out of 5. Yesterday it was a 3+.
Okay.
So I'm bewildered.
Yeah.
I have no explanation. I know there's theories out there that say when you correct the upper joint, okay, and I'm more conservative than I am,
Right.
grabbing different theories. It's a mystery to me. I don't know why that maneuver caused you to feel like your posture was just, much improved, and why your strength improved in certain areas of your body, and why you stood up and felt like your feet no longer pronated as much. Why you, on the table right after I did that correction, you said, my head feels clearer. Was that your phrasing?
Yeah.
Okay. Rather than me grab theories and say, oh, it did this and this and this, I could grab some theories, but I'm going to say I don't know, and this is one of the most astonishing responses to a Atlas on axis mobilization, which I did very conservatively in a very safe direction, respecting the vertebral artery, etc. Same thing for the OA joint. It's a mystery. I'm astonished. I'm pleased with what we gained, and I'm going to scratch my head all day long. Thanks very much. I appreciate it.